Momelotinib was approved in September of 2023 in the US for patients with myelofibrosis and anemia. There is no line of therapy stipulated in the label, so it can be used frontline or in later lines. It's a very useful drug that has been compared head-to-head against Ruxolitinib and shown to have the same efficacy in terms of spleen, although not in terms of symptoms. It's also been studied extensively in the second-line setting after Ruxolitinib and really shown a very nice symptom signal there. So interestingly, a little bit different in that respect between the front line and second line. And in all the studies, it has a uniform anemia benefit. You get transfusion independence, you see the hemoglobin going up. And if you're switching somebody from Ruxolitinib, you see the hemoglobin going up very quickly. Some of that is taking away Ruxolitinib, and some of that is the benefit of Momelotinib directly. And one nice thing about Momelotinib is that if you're switching from Ruxolitinib, you can actually do it the next day. There is no need for a taper or overlap, which may apply to other JAK inhibitors like fedratinib or pacritinib, which have long half-lives and don't hit JAK1. But Momelotinib has a short half-life, hits JAK1 and JAK2, so a very simple transition from Ruxolitinib. Dose is 200 milligrams a day. It's a once-a-day drug, so different from Ruxolitinib in that respect. Of course, like all drugs, it has some guidance in the label for dose reductions, especially if platelets fall too much. Thrombocytopenia is a fairly significant side effect. Diarrhea is another one. It can cause some first dose hypotension. Good to be aware of that. Maybe start with taking it at bedtime. Peripheral neuropathy, fortunately, is rare, as is liver dysfunction, but those things can happen. One of the nice things that was only shown with Momelotinib thus far is that if you're transfusion independent at 24 weeks, you have a better survival. Now, some of that might seem intuitive, but it's really only been shown with Momelotinib.